Nephron sparing surgery, NSS, also known as partial nephrectomy, is a procedure where only the diseased portion of the kidney is removed, preserving as much healthy kidney tissue as possible. The scope of NSS has expanded significantly with advancements in surgical techniques and technology. Here's an overview. 1. Oncological scope. Small renal masses. NSS is the gold standard for treating small renal masses, particularly those Cation 4 centimeters, T1A tumors. Moderate-sized tumors. NSS can also be performed for selected tumors 4 to 7 centimeters, T1B tumors, depending on location and feasibility. Hereditary syndromes. Patients with conditions like von Hippel-Lindau disease or hereditary papillary renal cell carcinoma benefit from NSS to manage multiple tumors over time. 2. Functional scope. Preservation of renal function. NSS is particularly beneficial for patients with pre-existing chronic kidney disease, CKD, solitary kidneys, or conditions predisposing them to CKD. Reduction of risk of end-stage renal disease, ESRD. By preserving more healthy nephrons, NSS lowers the risk of dialysis dependence compared to radical nephrectomy. 3. Cosmetic and minimally invasive approaches, robotic and laparoscopic NSS. These approaches have expanded the indications for NSS, reducing morbidity and improving recovery times. Cryoablation and radiofrequency ablation. These methods may be used for patients who are not candidates for surgical NSS due to medical comorbidities. 4. Palliative scope. In selected cases of metastatic renal cell carcinoma, NSS may be performed to relieve symptoms or manage complications without significantly impairing quality of life. 5. Indications in special populations. Children. In pediatric populations, NSS is vital in preserving renal function for long-term health. Patients with bilateral renal tumors. NSS is crucial in such cases to prevent total nephrectomy and resultant ESRD. 6. Expanded applications. Complex tumors. With advancements in imaging and surgical expertise, NSS is now performed for centrally located or anatomically challenging tumors, sometimes with pre-surgical planning using 3D imaging. Post-treatment of other cancers. NSS can be used in patients previously treated with chemotherapy or radiation, where further renal function loss could be detrimental. NSS is a critical surgical approach that balances oncological control with the preservation of renal function and quality of life. The decision for NSS depends on patient-specific factors, such as tumor size, location, overall health, and functional kidney reserve.